Hey everyone! Welcome back to our channel, your trusted source for simple, clear, and reliable health information. Today, we're diving into a super important topic: prostate health. Whether you're in your 30s, 40s, 50s, or beyond, this is one of those subjects that every man, and even the people who love them, should understand. Prostate health, what every man should know. What is the prostate? A lot of people have heard of it, but they're not exactly sure what it does. The prostate is a small, walnut-sized gland that sits just below the bladder and surrounds part of the urethra, the tube that carries urine out of the body. Its main job is to produce a fluid that nourishes and protects sperm. It plays a vital role in fertility. But here's the thing. As men age, the prostate often gets bigger. Sometimes this can lead to health issues, common prostate problems. Now, let's talk about the most common prostate problems. There are three main ones you should know about. 1. Benign prostatic hyperplasia, BPH. This is just a fancy term for an enlarged prostate. It's not cancerous, but it can cause symptoms like frequent urination, especially at night, weak urine flow, or trouble starting and stopping your stream. 2. Prostatitis. This is inflammation of the prostate, and it can be caused by infection. It might lead to pain in the lower back, pelvis, or painful urination. It's more common in younger and middle-aged men. 3. Prostate cancer. This is the most serious of the three and one of the most common cancers in men worldwide. The good news? It's also one of the most treatable when caught early. That's why awareness and regular screening are absolutely critical. Symptoms to watch out for. If you or a loved one notices any of these symptoms, don't ignore them. 1. Trouble urinating. 2. Pain or burning while urinating. 3. Blood in urine or semen. 4. Frequent urge to urinate, especially at night. 5. Pain in the hips, back, or pelvis. 6. Erectile dysfunction. Now, these symptoms don't always mean cancer or something dangerous, but they do mean it's time to see a doctor. Prevention and lifestyle tips. Let's talk about what you can do to keep your prostate healthy. Because yes, there are real steps you can take starting today. 1. Eat a prostate-friendly diet. Your diet plays a huge role. Focus on 1. Tomatoes. They contain lycopene, which supports prostate health. 2. Broccoli and leafy greens. 3. Fatty fish like salmon, rich in omega-3s. 4. Nuts and seeds. 5. Reduce red meat and processed foods. 6. Cut back on sugar and alcohol. 2. Stay active. Regular exercise, even brisk walking for 30 minutes a day, has been linked to lower risk of prostate issues. It also helps regulate hormones that may influence prostate growth. 3. Maintain a healthy weight. Obesity is a risk factor for both prostate problems and prostate cancer. Losing even 5–10% of your body weight can make a difference. 4. Don't smoke. Smoking has been linked to a higher risk of aggressive prostate cancer. 5. Get regular screenings. Starting at age 50 or 45 if you're high risk, talk to your doctor about PSA tests and digital rectal exams, DREs. Early detection saves lives. Myths and misconceptions. Let's bust a couple of common myths real quick. Myth 1. Prostate problems only affect older men. Truth. While it's more common with age, issues like prostatitis can affect men in their 30s and 40s too. Myth 2. All prostate problems mean cancer. Nope. Many conditions like BPH and prostatitis are non-cancerous but still need attention. Myth 3. PSA tests are always accurate. PSA is a helpful tool, but it's not perfect. That's why it's used in combination with other tests and clinical judgment. When to see a doctor? Look, guys, I get it. We're often told to tough it out or ignore problems. But when it comes to prostate health, that mindset can be dangerous. If you're over 40, start the conversation with your doctor. And if you notice any of the symptoms we mentioned, don't delay. It's always better to be proactive than reactive. Your prostate may be small, but its impact on your life is anything but. Taking care of it means looking after your urinary health, sexual health, and long-term well-being. So here's your call to action. Start eating cleaner. Get active and schedule that checkup. Talk to the men in your life about this, brothers, dads, sons, friends. Let's normalize the conversation around prostate health. And hey, If you found this video helpful, please give it a thumbs up, subscribe for more science-backed health tips, and leave a comment if you've got a question or topic you'd like us to cover in a future episode. Thanks for watching, and until next time, stay informed, stay healthy.